We're group number 3, and our presentation is about whether the ketogenic diet works in weight loss efforts. My name is Monica Andujo.
My name is Maggie Garcia.
I'm Winter Minton.
All right. To introduce the topic, there are many diets that claim to promote weight loss, and one of these is the ketogenic diet, also known as the keto diet for short. The keto diet involves eating meals with low carbohydrates but involve high fat. This diet reduces the risk of cardiovascular disease or diabetes or chronic diseases, but most importantly, it helps maintain weight. This is due to fat being the main source of energy instead of carbohydrates. So within the keto diet, there are 4 types of sub-keto diets: the standard, the cyclical, targeted, and the high protein. The cyclical is how do you say it? Temporarily, so 2 to 3 days max. The targeted is primarily used by athletes, and high protein, as the name states, is high in protein and high in fat. And the standard is the one that most of the population uses. Also presented in the articles, it is strict. The keto diet is strict and difficult to keep up with, especially for people who are can't resist carbs such as cake, soda, and all that sugar stuff. As mentioned by Diet Doctor, the least amount of carbs is the best to maintain weight or promote weight loss. This is because carbs are replaced with fat as the main energy source, and fat is broken down in the state of ketosis.
Some other present findings that we saw were that the ketogenic diet may enhance cognitive function and it provides neuroprotective benefits. There's a protein that upregulates fat oxidation and fat transport, which helps the neural signaling, and this is also activated during ketosis. The benefits can be useful, especially for people who are dealing with cognitive decline due to old age and the beginning stages of the Alzheimer's disease. There's no long-term benefits of this diet according to recent studies. The studies show that initially people have very quick weight loss, and then over time it kind of just balances out to other diets, where other diets are kind of the weight is lost over time, but in the end the same amount of weight is lost. So with that being said, there's not really a long-term benefit to utilizing the keto diet. The diet places the body in a state of ketosis, which occurs because of the breakdown of the fat cells. Some potential adverse effects that can occur from the diet include fatigue, loss of energy, muscle cramps, bad breath, and changes in bowel habits. But this is also something that can happen with any kind of drastic dietary changes. So that's something to keep in mind as well.
So this section is about why is the ketogenic diet controversial? And it's controversial because it's keeping the body in a state of ketosis. And this can often get confused with keeping the body with the body being in ketoacidosis, which is increased level of ketones in the blood. Although when fat is broken down, it does create ketones, which can go into the blood. It's not enough necessarily to make the body be in a ketoacidosis state. This is usually caused by hyperglycemia, which is a condition when blood glucose levels tend to rise. And this is seen in patients with type 2 diabetes. So that's the first type of ketoacidosis. However, it's been clinically proven that ketoacidosis actually is effective in lowering blood glucose levels, so there wouldn't be a correlation between those two. However, there is a correlation with non-diabetic acidosis, and that's from starvation. That it's not often seen in the keto diet, but it is a potential to happen, and that's because keto diets are low in carbohydrates, and then they may have the potential to create ketoacidosis. The starvation is usually absent in this diet, so it's unlikely to occur, but it does if the keto diet isn't nutritious and doesn't have the nutritional value that the body needs to keep up with demands. So to sum everything up that we talked about today, the keto diet has many benefits to the human body, especially in maintaining weight. Its long-term use has not been proven to be effective just because the body tends to balance everything out. This diet has positive effects on health, including lowering blood sugar, decreasing cognitive decline in patients who have diseases such as Alzheimer's and dementia. And then while long-term ketosis is controversial in media sources, research does not support ketoacidosis is likely to occur unless there are underlying medical conditions such as diabetes. But it is also important to note that one thing that's really important is that you want to speak with your healthcare provider before undergoing a drastic change in diet just to ensure that no adverse effects arise. And it's also important to make sure that if you do undergo a keto diet, that you visit your physician regularly to check the ketone amounts in the urine, and then also to make sure that you're maintaining an adequate blood glucose level. And
that concludes our presentation.
Thank you.
Bye.
Thank you.